Welcome to video 4 of my Revived Pelvic Floor Health Core Rehab Core Back Immersion program. And this is the 4th video of our free 7-part journey series. And today, I have my beautiful daughter, Bella, who's 12 years old, but needing some pelvic floor strengthening as well. No matter what age we are, it's nice to keep it strong and healthy. And this is the comprehensive guide, the entire blueprint of my Core Back Immersion therapy. And this has a significance of pelvic floor health, and we'll be combining a lot from video 1 to video 3, learning the proper breathwork, gravity-assisted pelvic floor, using a foam roller and the ball, together with pelvic clocks, pelvic floor release, and core stability, using the elastic band and the ball. And if you make one promise in this video, is that you will absolutely cannot afford to miss this. So grab a pen and paper to listen, or you can join me with the ball, elastic band, and foam roller. If you don't have a ball, you can sit in the chair. If you have no elastic band, you can use any light-weighted bottled water, canned goods, or dumbbells. And if you don't have a foam roller, roll a towel to make it thick, up to 6 inches diameter, to elevate your weak pelvic floor and hip flexors and lower abdominal muscles. If you're postpartum, perimenopausal, or menopausal women with chronic pelvic floor issues from diastasis recti, umbilical hernia, weak bladder with incontinence, stress urge, or latchkey bladder, if you have a prolapse or pelvic organ prolapse, or pelvic pain. So in this video, we will unveil the precise steps you need to take in order to regain a stronger core, improve pelvic floor health to make it more functional. As mentioned in our previous videos, we discussed techniques such as engaging the core, how to do proper breath work, pelvic floor utilizing proper deep breathing, zipping it up motion, learn about that lower abs to navel with Kegels, and enhancing mind-body awareness. And we talk about Kegels alone is not the solution, and sometimes it makes it worse without moving our hips. If you have tight hips, that results to a tight, non-functional pelvic floor. Also demonstrated simple strategies to stretch the tight pelvic floor, hip groin, improve bladder function using an elastic band and physio ball, and improve your overall posture if you're slouched forward with tight rib cage, with bearing up on your lower ribs, the floating ribs, and also that downward pressure from the lumbopelvic hip complex, which is the core with not just the abs, but the lumbar spine, the pelvic floor, the hips, is a complex interwebbed together that's connected to our overall health. So in fixing the pelvic floor dysfunction, especially with individuals with diastasis recti, or we call that a gap on your abdomen, which is an overstretched linea alba, is not really means it's really fully separated, because of that weakness on the pelvic floor, the web underneath that will support that results to that mommy pooch. It's not just the fat accumulation, it's actually the weakness of difficulty engaging that area. And we also learn how to lift the pelvic floor prolapse. So if you haven't watched the first 3 videos, we strongly recommend doing so. Before proceeding with this entire blueprint, make sure you go back to video 1 to 3, because they contain valuable and practical information that you can start implementing right away. So in this 4th video, we will focus on remarkable pelvic clocks and hip mobility opening, a form of flexibility training, not just passive stretching, but dynamic movement patterns to trick your brain to relax your tight area. That combines stretching and muscle activation to achieve maximum static flexibility while your lower extremities are elevated. And we're also going to use the wall today. So we will slowly sit up and stand and focus and use the wall as a program to engage your deep core. When combined with the use of an elastic band, which is a great way to target your postural muscles and the slow twitch muscle fibers that will support your sitting, standing, and walking tolerance. And this pattern strengthens the body and limbs in a safe and effective manner, particularly for individuals with a weak back, core, and postural muscles. And guess what? Once you have more stability on those areas, it will help support your pelvic floor and improve the engagement on your lower abs and your whole abdominal muscles, especially if it's overstretched after 9 months of pregnancy. So we are beginning the program now. by lying on your back. So Bella, you're gonna lie down and we're gonna place your feet up on the ball to support your weak lower abdominal muscles. And we're gonna place the foam roller out of the way for now on the side. And we're gonna use that later before we start lifting our legs. First, we're gonna do proper breath work with our legs elevated. And I have the elastic band to engage our core. With your hands up. And because most of my patients with weak pelvic floor, they also have very tight hamstrings. So from inhale, you're going to expand your abdominal muscles, lateral rib cage out to the side. Separate the bands apart to the side and breathe out. When you exert effort, it's nice to engage this area and zip it up from your lower abs to your navel. Inhale as you relax your hands. I'm really expanding my abdominal muscles. Zip it up, exhale and open. Inhale. Exhale. Breathe in as you relax your arms. Go back to the center. And then exhale, open. Last one. Inhale. And exhale. Now hold that bands apart. We're going to do some pelvic clocks. So pelvic clocks is when you press at 12 o'clock. If the 12 o'clock is on top of your abdominal muscles, you press on that area and then inhale again and press on your lower abs. You can use your fingers to press on your abdominal muscles to give signals. So inhale, exhale 12 o'clock. I'm squeezing on the upper near my rib cage. Inhale, exhale, press on your lower abs. Good job, Bella. Inhale, expand your abdominal muscles. Exhale, press on your between your rib cage. So the upper area of your quadrant of your abs. Again, inhale, press at 6. Now we're going to do the clock work. So from 12, inhale, you go to 1 o'clock. So 1 o'clock is on the left side of your abdominal muscles on the top part. Inhale, and then slowly go to 2. I'm pressing at 2. Inhale, press at 3. This is great for those who had C-sections as well. Inhale, exhale to 4. And when you get the cut on your abdominal muscles, it gets really deconditioned and weak and difficult to engage. 5 o'clock. Inhale, expand, and let's go back to 6 on your lower abs in the middle. And tighten as hard as you can. Zip it up to your lower abs. Inhale, expand, and 7 o'clock. Inhale, exhale, 8 o'clock. Press on your right side lower abs. Inhale, exhale, 9 o'clock. Inhale, exhale, 10 o'clock. Inhale, exhale, 11. Inhale, go back to 12. Good job, Bella. Now we're going from 12 o'clock counterclockwise all the way to 1. This is great to warm up your abdominal muscles, especially if you have diastasis recti. So inhale, exhale 12. Inhale, exhale 11. Inhale, exhale 10 o'clock. Inhale, exhale 9 o'clock. Inhale, exhale 8 o'clock. When you gently tap your abdominal muscles, it helps engage those tiny muscles that sometimes they get deconditioned. Inhale, exhale 6. And if you have numbness from C-section, that's okay. I had 2 C-sections, so it's a little bit numb still, and it's always going to be numb, I think, forever. Especially I had 2 cuts, twice of C-section, and there's layers and layers of fascia. 3 o'clock. Inhale, exhale 2 o'clock. Last one, inhale 1 o'clock. So my recommendation, do clockworks, even 5 repetitions every single day. So now with your hands up pointing to the heavens, now we're going to slowly extend one leg. As you extend one leg pointing to the heavens, I'm lifting and stretching my right arm up and my left hand towards my left hip. And balance and breathe out. Inhale down as you slowly lower your foot down and the bands relax in the middle with my hands pointing to the heavens. And then switch to the other side as I extend my left and left arm extended and breathe out. Inhale down. Expand your abdominal muscles. Exhale, lift, extend. Good job, Bella. How are you feeling? Good. Inhale, back center. Exhale, switch. Feels so good to stretch those tight hamstrings. Breathe in. Breathe out, switch. Inhale. Exhale, switch. Inhale. Exhale, switch. Last set on your left. Breathe in and breathe out. Now we're going to place the band behind your back like this, Bella. And we're going to press up to the heavens like a chest press. So as you breathe in, lift and stretch and lift one leg up. So I'm stretching my right hamstrings, my toes pointing to the heavens. Make sure your toes are really pointy. And then from this position, Bella, we're going to make small circle like a size of a small dish, making sure you're really engaging your abdominal muscles as you breathe in and breathe out. Squeezing your core in from your lower abs to your navel. 5, 4, 3, 2, 1, and then reverse circles. 10, 9, keep your knee lock. 8, 7, 6, 5, 4, 3, 2, and 1. Well done. Relax your arms and then press up again and then extend your left knee, this time toes pointing to the heavens. As you breathe in, breathe out circles. 10, 9, 8, small circles. 7, 6, 5, 4, 3, 2, 1, and then reverse circles. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Well done. Now we're going to extend your legs. As you extend your legs, rest it a little bit. You okay, Bella? And now place your hands on your side. And as you inhale, exhale slowly. Make sure your hands are on the side of the mat. And then slowly lift your hips up and extend your hips up and balance. Squeeze your core in, try not to fall off the ball. And balance. And inhale, exhale, go down. You're gonna feel that challenge on your core strength and your hip strength. You okay, Bella? It's shaky, right? So it's a lot of really mindful and slowing down. Breathe in, breathe out, lift. Let me help my girl. Let's see, make sure your toes are really engaging. As you can see, she's a little bit shaky. As you breathe in and breathe out. And slowly go down. Making sure you can really lift your hips up. Breathe in, expand your abdominal muscles and zip it up and lift. Your core strength is so important for core stability. So if you're shaking a lot, it's a sign of a lot of weakness happening, and it's okay. That's why we're starting now. If you find the ball too challenging, you can just prop a lot of pillows and lift, or you can use a stable chair. Breathe in and breathe out. Good. And good job, Bella. Now we're gonna sit on the ball. Grab the elastic band. So those are some of my exercises inside my Revive Pelvic Floor Health Core Rehab 8-week. And now we're gonna do some pelvic locks even in sitting on the ball. How are you feeling, Bella? You felt good on your core? It was a challenge for her, and no matter what age group we are, it's nice to keep strong and healthy. Okay, my friends, we're gonna start feeling our pelvic tilts as you roll back and forth. Make sure you inhale, exhale as you tilt back. Inhale, exhale, tilt back. Trying not to fall off the ball. As you inhale and exhale. Now we'll do circles. As you breathe in and breathe out. Feels so good in the hips, and this helps hug your pelvic floor, especially if you have a prolapse. That will give you that proprioceptive feedback to engage and zip it up from your lower abs to your navel. And if you don't understand the zipping it up, please watch video 1 and practice that. And then reverse circle, and it's going to be in the description down below or in the info card at the end of this video. Breathe in and breathe out, reverse circles. Well done. Now with the band, we're going to open separate. As you inhale, exhale back center. 4 more. Squeeze your upper back, improve your postural awareness. 3 more. 2. Last one. And 1. Now we're going to challenge by opening your knees out more to a goddess pose with your toes pointing sideways. This will help your hip groin area. And as you lean on your right, you lift with your right arm in the diagonal position, left and right. Extend the other leg, extend your right knee, Bella. And then bend your left, and then switch, extend your left, lift your right hand up, and diagonally back and forth. As you breathe in, breathe out, really engaging your upper back muscle. That will help your posture, Bella. Engage. Inhale, exhale. 4 more. 3, 2, and 1. Well done. Now place the band behind you. Open your knees out more. And in this position, we're going to slowly engage your upper back muscles and then twist. Engage your obliques. Try not to swing your arms so much, keeping it aligned together. Inhale, exhale. You're getting tired on your arms, Bella? So that really shows her posture on her upper back is really fatiguing, and she's still young. Needs to learn how to build muscle safely. And it shows that even though she could do gymnastics, doesn't mean she's strong on other parts of her body to prevent neck and shoulder injuries. Last set. It looks so simple, right, Bella? But you feel the burn on your upper back and shoulders. Well done. Now lift your hands up overhead. Breathe in. Grab the mat with your toes to protect yourself as you forward fold slowly. Inhale. Exhale. As you lean forward, keeping your back straight. Breathe in. Breathe out. Last one. Inhale and exhale. So that's one of the beautiful techniques I utilize for my patients. Now we're going to be in kneeling position. And if you can't reach down because of the size of the ball, get a smaller ball. This is too big for me, but I could still manage with my strength, and I could balance with making sure your hands are level to your shoulders, your knees are level to your hips. Bella is perfect on that size, and she's gonna kick one leg up. I'm kicking with my left leg and bounce, making sure she's not twisting her spine, so she's twisting a little bit. And core engage. And then down as you breathe in and breathe out, switch to the other side. Keeping your legs straight. So let me help Bella. She might lose her balance. So I'm here to support her, just to show you what needs to be done. I'd rather have it lower than twisting her spine. And then down. Inhale. Exhale, switch. So she's twisting her spine. I like it stable. So I don't want her to hyperextend here. Just really engaging her glutes and extending, and breathe out. Inhale down, exhale up. Good. 2 more. And this will help support your core strength and your pelvic floor if you have good stability on your pelvis and your hips. Glutes muscles. The glute muscles are really the one to support, especially if you're sitting a lot. Breathe out as you kick. Good. The next one is fire hydrant or peeing like a dog. So from this position, she's going to lift her knee and foot out to the side, keeping her foot level to her knee like this. Align and down and switch. So she's twisting her spine. Inhale down. Exhale, switch. Leveled her foot and knee. And down. Inhale. exhale, lift. So she's twisting here, align. So I'd rather have it lower than forcing it to the side, twisting her spine. Inhale, switch, level. Breathe in down, exhale out to the side. 2 more. Last set. Well done. The next one is bird dog. So bird dog is when you reach with the opposite arm and then opposite leg. So I'm lifting my right arm and she's extending the left and balance. And breathe out. Inhale down and then exhale, extend, slow and steady. Good. This will target her posterior chain muscles, her back, all the way to her hip and her core strength. Inhale, exhale, switch. Breathe in, down, Bella. Exhale, switch. Beautiful. So she's a beginner and it's okay. She's learning how to connect with her body and strengthen her core and posture muscles, the lumbo-pelvic hip complex. And this is connected to our pelvic floor health as she continues to grow to a young lady someday and have that confidence. Inhale, exhale, switch. Getting tired, Bella? Yeah, last set. And even 5 repetitions for absolute beginners is okay. It's better to start than not doing even 1 repetition, right, guys? Before we proceed to 10 reps. Okay, Bella, grab your foam roller. You feel a good workout, right? And this is great for any moms out there who wants to train their young daughters to join them if they are able to follow through directions. So now we're gonna do some gravity-assisted foam roller. And this is great for anyone, even men. I have patients with bladder leaks from prostate cancer removal and got the condition from all the cuts on their stomach that's where they robotically remove the cancer. And this is one of the best way to protect the incisions. If you have C-sections, make sure you have a clearance from your doctor as long as the C-section is fully healed. Usually, you can start working out with this kind of program 8 weeks post C-section as long as there's no excruciating pain. And of course, everyone's unique. Make sure you have a clearance from your doctor. Are you okay, Bella? Okay, my friends, making sure when you place the foam roller is on your pelvis, not on your low back and not on your hamstrings. So from this level, grab the elastic band again. And we're gonna slowly, with gravity assisted, engage our core muscles and our bladder. So it's nice to keep it strong and healthy and warming it up before we do any lifting our legs. As you breathe in with your hands pointing to the heavens, expand your abdominal muscles. Zip it up from your lower abs to your navel. Zipping up, as I said, is like a tight jean. You don't want your skin to be touched by the zipper, and you want to make sure you zip it up all the way to your navel while keeping your spine in neutral position, and exhale through your mouth. Purse lip. I don't want a breathe out like this. When you open your mouth so much, there's no pressure to engage your pelvic floor. You want a small air just coming out of your mouth. Again, inhale. Exhale, zip it up and separate the bands apart as you zip up. Inhale, back center. Expand. You can see my abdominal muscles expanding. That will give space for my pelvic floor as a piston motion with the diaphragm. Zip it up, exhale, and separate. Last one, inhale. You okay, Bella? Exhale, zip it up. Now, from your separation of your bands, now you're gonna lift your heels up for extra challenge. Inhale, lower the bands back to the center and lower your heels. Expand your abdominal muscles, zip it up and lift your heels up, separate the band. Inhale, back center. Exhale, zip it up and separate. 2 more. Inhale. Exhale, separate. Last one. Inhale. Exhale, separate. Now we're going to do some gentle marches. As you breathe in, Zip it up before lifting your knee up to tabletop where your knees bend to 90 degrees. And then the band, same side, overhead. So right arm up, toes pointing away. Keep it bent more, Bella. There you go, like a table. Exhale. If the foam roller is rolling, you can let go of the band and hold on to the foam roller. Want to hold on to the foam roller, Bella? Hold on for now for her because she's still very weak on her core and it's okay. Inhale, down. And then switch to the other side. Exhale, lift your left knee to tabletop, left arm up and breathe out. Inhale, down. Exhale, switch. Squeeze your core in. Breathe in. Breathe out. Inhale. Exhale, switch. Inhale, down. Exhale, switch. 2 more. Last set. Breathe in. Breathe out. And last one on your left. Inhale. Exhale. Now we're going to challenge with leg extension. So as you tabletop, breathe out. Exhale, extend further. Toes pointing to the heavens and then bend to inhale and then exhale down. Switch to the other side. Left knee, tabletop. Exhale, extend, bend and down. And then switch to the right. Breathe in, breathe out, extend. Inhale, bend all the way down. And then switch to the left. Bend as you inhale. Exhale down. 2 more. And then to the left. Last set. And last set on your left. Well done. Now we're going to do circles. You can place the band again on your shoulders, behind your back, Bella, if you like, but hold on to the foam roller for now. I don't want you to lose your balance because I don't want the foam roller to burst out of her back. I don't want her to get hurt. Bend her knee and then extend. We're going to do leg circles like a size of a small dish as you press forward with the bands behind you. It's like a chest press with a hold on the leg circle. Like a size of a small dish, locking your knee, toes pointing to the heavens. Breathe in, breathe out. Good job, Bella. 5, 4, 3, 2, 1, and then reverse circles. 10, 9, take a deep breath. 8, 7, 6, 5, 4, 3, 2, and 1. And then switch to the other side. Inhale, exhale, extend and lock and circles. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and then reverse circles. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1, and down. Well done. Are you okay, Bella? Now you can hold to the foam roller for absolute beginners. Let go of the band. I'm holding on also, so you can see. Keeping your both legs up is a little bit more challenging, right, Bella? Now we're going to gently tap one foot at a time as you breathe out. Inhale, back center, and then switch. Hold and control. We'll do 9 more. So this helps lengthening and control. As you breathe in, breathe out. 8 more. Breathe out as you tap. Inhale as you go up. 7, 6, 5 more. 5. Tap gently. 4. Make sure when you tap, not too close on the foam roller, a little bit farther away to really engage your core muscles. 3. 2. Foot taps. And 1. Well done. Are you okay, Bella? Is it hurting your back? No, it's just rolling off down. So that's why you can take a break if you need to, because this is the last one. We're going to extend one leg. You can keep the other leg hanging up or just keep it down for those who can't balance yet. But for me, I could go up. So just follow Bella for those who can't keep both legs up. And then slowly go down. Inhale and then exhale up. Straight leg raise. Dorsiflex as you go down, which means toes pointing you as you go down. Inhale, tippy toes, toes pointing away as you go up. Dorsiflex and then down. Tippy toes and lift. And down as you breathe out. Inhale before lifting, exhale up. Inhale again, exhale as you go down. Last set. And down. And then switch to the other side. I'm bending my right knee to my chest, almost like tabletop, extending my left knee, toes pointing away as I breathe in. Breathe out, lift. Dorsiflex down. Tippy toes and lift. Dorsiflex down. Inhale, exhale up. Inhale, exhale down. 4 more. 3 more. If this is too fast for you, pause the video. You can slow it down. 2. Last one, Bella. And down. Well done. Now you can let go of the foam roller now and relax your back. And we're going to do some lovely deep breathing while holding on the foam roller for added challenge. So with your hands on the foam roller, we're going to do some bear plank. So bear plank is a great way to engage your core without straining your diastasis recti, because doing a full plank is too much strain that could have doming or coning effect. We don't want the separation to get worse. And as I said, it's not full separation, it's just overstretch linea alba, a fascia on your abdomen. So with your toes grabbing the mat, a few inches off the mat, lift off your knees up and breathe out. Zip it up. Make sure you breathe out and zip up before you lift. Inhale, expand your abdominal muscles, zip it up and lift off. And then down. You feel that shakiness on your stomach, Bella? Yeah, it's a challenge, right? Inhale, keep your back straight, Bella. Look up. I don't want her to hunch up like that. Inhale, exhale up. And hold it for 5, 4, 3, 2, 1. Bella could only handle for 1 second because her core is weak. And she will progress up to 5 seconds, up to 10 once you get stronger. Last one, Bella. Inhale, exhale, lift. 5, 4, 3, 2, and 1. That's okay, Bella. Now you know those are the things you need to strengthen. Now we're going to go to a wall to do some wall Pilates. So follow along with us. Find a wall in your home. Pause the video if you need to. So let's go to find a wall, Bella. Okay, my friends, we are on a wall. Now we're going to lie on your back. We're going to use the ball for core exercises and pelvic floor for our hip adductors. You're going to hug the wall with your legs on the wall and squeeze this as hard as you can. As you breathe in, hold on with your hands, press. Inhale, exhale, lower your feet apart to a V stretch and arms overhead. And breathe out. Inhale, exhale, lift your feet. It's okay. Bella's still having a hard time coordinating. It's okay. And then squeeze the ball. And then down, out, arms overhead. And then that's a good contract, relax. Now you can stretch further. Your hips could be a few inches off the wall and then back center and slide up. So Bella, let's see how you do it. Bella, come closer to the wall. And then squeeze the ball between your thighs to strengthen her pelvic floor, her hip adductors. And now I'm gonna do it We have 2 more to go. We're almost done, as this is the entire blueprint and there's more inside my Revive Pelvic Floor Health. I'm just trying to cover as much as I can. Arms overhead. And then squeeze the ball. If you don't have a ball, you can just squeeze your knees together. You can use pillows as well. Last one. Breathe in and breathe out. And squeeze. So hip adductors are so important to strengthen, especially if you have a prolapse. And that's it. And there's so much more in my wall Pilates inside my Revive Pelvic Floor Health. Don't miss out. There's 3 more videos. Video 5 is amazing routine where we're going to do more wall Pilates first and proceeding to a lot of core stability and lower body strengthening and midfoot support all the way up. Some yoga hip opening release. And video 6 is where I'm going to share my amazing testimony of my recent graduates of my Revive Pelvic Floor Health Core Rehab to show amazing results and to learn more about my amazing relaxation, how to do the reverse Kegels or reverse Kegels, which is opposite of Kegels. And video 7 is where I'm gonna answer most of your questions about my Revive Pelvic Floor Health Core Rehab, and we're gonna do everything we learned from video 1. I'm hoping you enjoyed this video. Thank you, baby girl Bella, for joining me today, and she did a great job. And even though she's a beginner, no matter what age you are, it's not too late to begin. You can be 12 years old or younger or way older when you're retired and you need to keep that pelvic floor bladder control strong and healthy. And you miss out my other videos of my free 7-part video journey series. My first 3, watch video 1 over here, learn how to do proper breathing. That's the key component. And video 2 on how to use gravity-assisted foam roller. Until my next video training, always remember, be safe, be well, and healthy you. Bye!